Hi everyone, my name is Susie Mestrin and I will be giving my project presentation on a brain disorder called Parkinson's disease. So here I have the definition of Parkinson's disease coming from the National Institute of Aging. It states that Parkinson's disease is a disorder of the central nervous system that leads to shaking, stiffness, and difficulty with walking, balance, and coordination. It is mainly characterized by tremors at rest, rigidity, and slowness or difficulty in initiating and executing movement. A quick fun fact about Parkinson's disease is that several celebrities have it, including Linda Ronstadt, Ozzy Osbourne, and Muhammad Ali. Parkinson's disease is a slow, progressive, chronic neurological disease that affects a small area of nerve cells in an area of the brain known as the substantia nigra. These cells normally produce dopamine, a neurotransmitter that transmits signal between areas in the brain that, when working normally, coordinates smooth and balanced muscle movement. Parkinson's disease causes these nerve cells to die, and as a result, body movement is affected, causing people to have difficulty walking and talking. 10 sets of genes work at abnormally low levels in Parkinson's patients, genes that turn out to play various roles in the mitochondrial energy production. Loss of melanin-containing neurons produce characteristic changes in depigmentation. And again, here in the picture on the right shows the loss of dopamine, resulting in movement disorders. Parkinson's disease usually starts with a tremor in one hand. Other symptoms include stiff muscles, difficulty walking or talking. In sleep, early awakening or restless sleep occur. Within the whole body, there's fatigue, dizziness, and poor balance. Distorted sense of smell or even loss of smell can occur. Mood disorders such as anxiety or apathy occur. And finally, there are reduced facial expressions or stiff jaws in those with Parkinson's. No specific test exists to diagnose Parkinson's disease. Doctors trained in nervous system conditions will diagnose Parkinson's based on your medical history, a review of your signs and symptoms, and a neurological and physical examination. Currently, there is no cure for Parkinson's, but medications can help control symptoms. Onset of Parkinson's disease and risk factors. Here are some of the risk factors of Parkinson's disease. Young adults rarely experience Parkinson's disease. It ordinarily begins in middle or late life, and the risk increases with advancing age. In your family history, having one or more close relatives with the disease increases the chances on one getting the disease. Most menopausal women with low estrogen levels have more risk of developing the disease. In agricultural work, exposure to environmental toxins such as pesticide and herbicide promotes neurotransmitter damage. Those involved in farming have a greater risk of getting the disease, and those with low levels of vitamins, researchers found that they develop severe Parkinson's symptoms. And last but not least, trauma to the head, neck, and upper spine increases the chance of getting Parkinson's. Parkinson's disease is recognized as the second most neurodegenerative disorder. Approximately 6 million people are diagnosed with Parkinson's worldwide within all races. However, it affects 1% of the population over the age of 60, but is rare in individuals younger than 50 years old. And lastly, males are more affected than females. Here are my references. Thank you guys very much for listening.